Good morning,
Hey, we're
Kelly.
twinning.
Or is it afternoon now?
Yeah, only just by 1 minute. We're twinning in colors. We're channeling each other.
I know, pretty good. I like that.
Right? So I was just telling everyone, Dr. Claire, that you have a myriad of talents and areas of expertise. Today, we're only going to be touching on probably one of them, which is pregnancy and chiropractic care, the benefits thereof. But we're going to be doing another session really specifically on pediatrics. And I say pediatrics starting really at babies, like fresh out of the womb.
Oh, newborn birth.
Yeah.
Oh,
Get them, I mean, the sooner the better, and we'll tell you all the reasons why. And then, yeah, we'll go from there. But we already have a date in the book, so we'll talk about it at the end. But for everyone who's joining us right now, we are going to be talking about the benefits of chiropractic care during pregnancy today. And before we start, as everyone is coming to find out, our toolbox is really to give parents tools, help them. When you know better, you do better. And that's the whole point of this, because we on the parenting journey are on life's grand improvisation. We're all winging it. You're a parent yourself. We do the best we can with the knowledge that we have. And so our objective is to help parents, ourselves alike, come up with more tools in our toolbox so that we can have more tools.
and that's huge. I love your, when you know better, you do better, because that's everything right there.
It
so
is.
It's great.
It is. Yeah. So if anyone has any questions live, feel free to chime in, and I will ask Dr. Claire live. But otherwise, I like to start with kind of hearing how you found your way along the chiropractic path. I know it's only one of the things you do, but and I also just sent you a link. I'll tell you in a second. But please,
can't wait.
how you came to find chiropractic care as your mission.
Well, and as you said, it really is my mission. My dad was a medical doctor, and my background is actually pharmacy. And I joke around that I was a legal drug dealer, and that was inpatient, outpatient. But what kept happening is I would like say, wait a minute, something's not making sense. Maybe I was at the beach. Maybe I missed that class. But drugs and medicine just didn't coalesce with. I grew up on a ranch. I saw things how naturally occurred, and medicine, kind of getting further and further from the natural. So I kind of termed it the medical money machine. And then I said, wait a minute, there has to be another way. So the powers that be kind of slapped me in the face multiple times, and I found out that chiropractic really was the way. And I'm really into sports, so my first focus was I was going to be the chiropractor to the Oakland Raiders,
Yeah,
the Las Vegas Raiders. So my focus first was sports injury, etc. Until, there you go. You find out you're pregnant, and you're like, OMG, what's going on now? And then that's where I went in and did a specialty. I got my fellowship in Pregnancy and Pediatrics to really find out how important chiropractic is, not just for the overall person, adult sports, but it's very integrated when it comes to the development of the baby in utero and the birth process, etc.
Yeah, no, that's something that, I mean, I've had 3, and interesting, my journey on each is different. But even some of the questions, because I actually found Dr. Claire, who, she's amazing. I mean, I actually just sent her a link before this started, because I saw all the acronyms after her name, which is all her areas of expertise, and it made me laugh, because it reminded me of watching Beverly Hills Cop, when to this day, even though I saw it in high school, I still remember DDO GSAOC, which was his job, and he had it across his hat because that was the title. And I saw so many letters that I actually sent it to you before this, so you can.
Oh, I can't wait.
You have some acronyms, and I realized that when I found my way to you was as any parent or as any person is in a time of need, right? So though I had been on the chiropractic journey myself, trying to help recover from a car accident, it was when my daughter was kind of signed off by Western medicine saying, we can't help you pursue other options. And this was like life and death for us. And so when Western medicine said, see ya, I was like, okay, where do I go? And I actually found you through my chiropractor, who said, look, if it were my kid, he would be driving 2.5 hours every day to see you. And I said, okay, that's good enough for me. So I got in with you, and I was actually pregnant at the time as well. So I started seeing you myself personally. But some of the questions that you asked, even on your new patient form, actually got me thinking, like, how many ultrasounds have you had? And I'm like, well, I'm older, high risk, blah, blah, blah. I had a lot. And then I started thinking, maybe, yeah. My baby didn't like it, but, you know, just started opening my mind to maybe there's a different way. Maybe there's a different way for me, a better way. I don't shun Western at all. I've used it. I've used it till they can't help me anymore. And that's when I started pursuing other options. But I mean, without going into the details, you saved my daughter's life.
Oh, thank you. It's very sweet.
And it's true. And it's just amazing when there's alignment and when the electrical circuitry is off,
right there,
all things bad can happen. So I started seeing you as a pregnant mother, but my key was my kid. You know, kids always first. And so there are lots of benefits. There's a poster in your office, which I see behind you now. I don't, because my numero uno was my daughter, but I was fortunate enough to come to while I was pregnant and be able to enjoy your care as a pregnant mother too. So with that said, I think for those of you who are tuning in, whether you have you go to chiropractic care yourself, you seek it out, you seek it for your children, whatever level of experience, I asked Dr. Claire to join us today so that she could talk to us about the benefits of chiropractic care. And because there are so many, we're going to start with just pregnancy right now, and then we will follow up on June 21st, I believe, is the date we selected.
Yes.
For a focus on pediatrics, starting right from birth. But let's go ahead and kick it off in terms of what are the benefits of pregnancy for any expecting mom-to-be?
Well, one of the things you brought up is very important. When it comes to my history, of course, I'm looking at conception, how did it happen, how the body is, like your body's perspective before you conceived, and same with your husband's, because that will let us know how the conception happened. So first, how cleaned out you are, as in, are you smoking, are you drinking, blah, 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 blah. In your case, we didn't have to worry about it. But ultrasounds are very important. Ultrasounds can actually burn at the muscle bone interface. So sometimes we can do too much when actually less is better, and we don't realize things that we don't think have consequences or side effects, they actually do. And when it comes to medicine, more things have side effects that you would not know about it, any of their screening methods or scannings that we wouldn't even think are relevant. So that's a big one, because again, that's going to let me know how your baby's developing. But when it comes to your body position as the baby's growing, okay, so we need to be looking at the pelvis. So one is, when we're looking, you're talking about the electrical circuitry. The nerves are actually very important, because what do the nerves do? I would be chiropractors, we bring spines wherever we go. So when those nerves actually help your body develop and let the baby grow much better, healthier. Why? Because your hormones are going to be more working correctly, more regulated, your muscle structures, your body's absorption of food, so that whatever you eat can actually help the baby. All of that's really relevant. But what most people also don't think of is, as your body's growing and getting bigger, right? Well, then the pelvis will get tweaked and can misalign. And it could have happened before, and then stuck there because it can heal wrong that way. Well, then the baby can't actually develop correctly. And then what might happen is the baby will become breech, because the baby cannot turn. The baby can become transverse lie because of the, the twist of the pelvis. It's very important also for when we're looking at in labor, because we can actually affect, the coccyx, the sacrum, all of these areas are very important for how the baby can actually descend down into the birth canal. So that would affect like back labor. It would be affecting, all the other different aspects of if your body's just going to be able to push it out, or you physically have to do the pushing. Most people don't realize when it comes to labor, your uterus actually will just push the baby out. You don't even have to push. So it all depends on that. So the body's position, but also as the baby's growing inside, right? If I have too much body weight and my pelvis and my low back are off, well, that's going to push the organs up. It'll be harder for me to breathe. I'll have problems with digestion. You'll get the heartburn because, all these organs in the upper cavity, I always joke around that it just feels like it gets shoved in the gullet. And my daughter's, her foot, I swear, just was kicking my lung. I'm like, oh. So all of those things, chiropractic can help. I mean, it's amazing just for comfort. No medications. You don't need Tylenol. We can relieve the sciatic. We can relieve the back pain. We can relieve all the, hard to breathe. And then, of course, it's going to happen is your head's going forward and you get more stress in that upper back that you might notice with this poster, that what it does is as the body's expanding everywhere, not just in your abdomen and pelvis, it's adding more and more strain as we keep getting bigger. And one thing we tend to forget is our blood flow will triple in quantity. So in that, we have to keep all that blood flowing to help the baby grow. And then we'll get the swelling. And then we'll get numbness and tingling going down our arms, and we'll get all the paresthesias. That's all stuff chiropractic can help very easily, very easily.
Well, that's really interesting because when you get pregnant, like your body is your temple and your vessel, right? And so whatever has happened in the past, and what for me, chiropractic and some other modalities, like I kind of did, I've never taken a Pilates class, but I did some one-on-one with a body worker who's just all about alignment. So it all comes to alignment because every time, if we think as just people, right, from infancy onwards, every time we've taken a major fall or whatever and just suck it up, and get back into it, our body compensates because our skeletal system and everything, shifts or tweaks or whatever, and we compensate, and then we keep building upon compensation. So we're kind of still working, but not as aligned and not as should be, or we could be, with alignment and getting those muscles to kind of hold in the proper position. And that's why you have to go back for chiropractic, is because everything's adjusting, and it takes your muscles a while too.
And with that, what you're saying is everybody doesn't realize that the basics of chiropractic is we've had that joint injury, and when it's moved, it heals wrong.
Right.
With that healing wrong, then we know the muscles are in the incorrect alignment because the muscle's connected to the bone, and then we get scar tissue. Get a new layer of scar tissue every 7 to 14 days. So your pelvis might have been, we use the term subluxated, out of alignment, and your pelvis might have torqued this way, and your sacrum might have gone this way, and it's healed wrong. It just doesn't go back. And just massaging the muscles, that doesn't go back. We have to kind of whittle away the scar tissue. And we need those to be movable so that that pelvis can expand. Because, honey, as you already know, and all of us that have, boy, do we expand when those cute little babies keep growing and growing and growing and growing. So people don't even understand that that's the basics. The basics is the joint complex healed wrong, and we have scar tissue. And you kind of have to whittle away that scar tissue so that then the body can do what the body needs to do.
Yeah, and that was something else I learned, is that you can actually rid yourself of scar tissue. And I didn't realize how regularly it kind of reforms or forms. Is that
exactly every 7 to 14 days?
And the importance of icing, like, that helps. I learned that firsthand from you. you know, even when with your kids, I mean, I ice if I really nail myself. But with my kids, like, yeah, now even though they're fighting and screaming, I do it because I don't want that scar tissue to form.
Brilliant. Bring down the inflammation as much as possible.
And you taught me that. So that was,
Yeah.
I know, right? Well, so we have, when you're pregnant, there's so much going on. There's so much change. You know, you're looking forward to, if you're having a rough first trimester, second trimester, and then when you're in second trimester, you're feeling as good as probably you're going to feel for a while.
Yeah, for the next 18 years, maybe 22 in my case.
Yeah. And then, so at what point would you recommend for someone who is interested in chiropractic care during their pregnancy journey, at what point would you recommend they try to find a practitioner?
Well, actually, I'm kind of weird. I think from the beginning, people don't know chiropractic is actually very important. It's very good for infertility, because if I have the pelvis tweaked, then the fallopian tubes can get kinked, and then the semen can't, you know, make it up to the egg. So we do a lot with infertility, and of course all that nerve flow, so that the body, and you know, to regulate the hormones. There's that. And I'm a strong proponent of cleaning the body out, doing a detox, and kind of neurologically getting everything set even before the pregnancy. But definitely in the beginning, when you're looking at your first trimester, most people don't realize that often that morning sickness is actually due to gallbladder. So to help relieve the morning sickness, the chiropractic adjustment neurologically will definitely help the gallbladder. There's a lot of great supplements we can do. And some of us that specialize in this, we actually can adjust the organs and get the internal organs flowing and get the system synchronized. So it really will greatly alleviate that gallbladder, because people don't realize the gallbladder, it might be small, but it's hugely important because it actually digests fats. And we need to have the fats for our bodies, for the hormones, for our hormones to actually function and utilize. So when we have massive hormone changes associated with being pregnant, because of course we know we have massive changes in hormones. Well, if my body can't digest the fats, then the hormones aren't going to work as well. And that's where you get a lot of the nausea. So for even some of those things, that's something I definitely do recommend. I'd start from the beginning, because the more I can have you neurologically, your flow, and have the, you know, organs function better. And of course, the, what am I saying? The pelvis and all those subluxations in better spot, chances of those sciatic, back pain, you know, numbness and tingling in the arms, all the paresthesias and things that we talk about, it goes down immensely. But that doesn't mean you don't have to show up at like 32 weeks.
Right.
Because a chiropractor can even help you there.
Yeah.
The earlier I can help you, the chances of, you know, in utero constraint, breach, transverse lie, all of these other baby positions won't happen. So a chance of medical intervention during labor greatly decrease. So that's kind of my perspective.
Interesting. Okay, cool. Well, I think I took it for granted because obviously I had a gap between mine, and my first pregnancy was easier because I was 10 years younger.
That's that age thing. I'm with you on that.
But beyond that, I had care for my body to help the process early on. Not so much with my third, and he did end up breech, but it was a drive to Vegas that I know the moment he turned. And then,
isn't that amazing when you can feel it?
Oh yeah, buddy, wrong way.
I know.
But you know, it's so interesting because I had I know the value, and you all heard me say that, you know, I certainly attribute it to life-saving in many ways. But my husband, not so much. You know, he seeks out chiropractic for medical care. You know, he injures himself, he goes to his chiropractor. For me, it's part of my wellness care and health care, and and certainly maintenance now that we've stopped the bleeding, so to speak. And it's that, I mean, I've seen, we'll talk about it more in the peds, but I've seen like instant changes that are amazing and lasting, and that's why I believe so wholeheartedly, because I've actually seen it when you've done your thing and not done your thing. But I think for a lot of folks is don't be afraid to try it. Don't be afraid. My hesitation was, I've got this big belly, you've got your tables. How does that work? But it does work. They have, you know, adjustments, and it does not hurt your, not hurt the baby.
It doesn't hurt. It doesn't hurt the mom. It doesn't hurt the baby. You definitely want to have doctors. I mean, we're all taught the basics, you know, in grad school. But I more am recommending people, if you're going to, you know, if you're more hesitant, go with chiropractors that have a background. My fellowship in pregnancy and pediatrics, you already know I lecture for the California State Board on it to all these other chiropractors, giving them the information so they understand more. First of all, we're going to be the ones of us that have really studied it and understand when it comes to pregnancy and pediatrics. Certain things we won't do. We won't put you on your side because we'll be adjusting you face down. But yeah, where are you going to put that cute belly? My table raises, right? So it does not feel good after that. That your pelvis is lifted. You're like, oh, it feels so good.
Yeah.
And so the adjustments are not going to be like if I was your chiropractor for your husband and I'd have to do, you know, my pressure would be more.
Right.
Your body doesn't need as much pressure, and there's a lot of other aspects that we can do. There is a recommendation I'll tell everybody all the time to go to the ICPA, the number 4 KIDS.org. And they have a lot of us chiropractors that are part of it. It's the International Pediatric Chiropractic Association. And so those are the doctors, a lot of them have gone through their fellowships. They've gone and gotten the information to really understand, because our bodies are a lot different during the pregnancy than they are pre-pregnancy, pregnancy, post-pregnancy. It is amazing how different our bodies become. So you would never really have to worry when you speak to a chiropractor that has some of that background, because they're going to be able to guide you through and answer any of your questions.
Yeah. Well, that's key, because I think that is the hesitation, because there's so much change going on. It's like, I don't want to hurt the baby. You actually aren't hurting the baby, and it's not
helping the baby.
Not hurt yourself either. Laying on the table, it actually is so many positives. So it's, you know, lean into that hesitation and fear, because it actually opens up a whole new, all things, channels, nerve ways, all kinds
of blood flow, lymph flow.
Yeah, and you do feel much better. And despite my advanced maternal age, I actually did all right with my pregnancies, because I had the care that I missed out, you know, when I was younger, but probably just, you know, I was a bull in a china shop when I was younger, and it was what it was. But older, certainly hard.
As we get older, there's the wisdom. We actually see more of, you know, oh, this can benefit me. Maybe this is what I should do.
No, sure. I mean, there's so many benefits. What was the, it reminded me of another DDO JSAOC. IPA.
The ICPA, International Chiropractic Pediatric Association, the number 4, KIDS, as in kids.org. They've got both.
So on that URL, that's where chiropractors who have completed a fellowship in pediatrics or pregnancy.
And pregnancy. And there's something else that's also really important is a lot of us also in this association, we've been certified in what's called the Webster Technique. And the Webster Technique is great at, we use the term removing the constraint in utero constraint, which means malpositioned the babies due to you know, transverse line breach, etc. And so the Webster Technique is a great technique to help the baby turn.
Yeah.
As I always say, get back in a better position, so then chances again of medical intervention is greatly decreases. It's always better to avoid as much medical intervention as possible, so the body can actually do what the body needs to do naturally.
Yeah, no, 100%. Very good point. So in terms, so I was alluding to my third was massive, gestational diabetes.
He's a boy.
He's a
He's a big boy.
He's a big boy. And he actually, because he was so massive and has a large cabeza, my husband, who, as I said, he's more of a chiropractic due to medical need as opposed to, you know, just preventive and wellness, saw him being born and was a believer instantly. Oh my gosh, every baby should have chiropractic care. I saw how they torqued him. I didn't see it, but he's like,
I know.
So our little guy was with you just days after he was born. And you've helped him along his journey. And it's amazing. You know, we've talked a lot about on these Toolbox series about listening to your mama's intuition, your women's intuition, your parenting intuition, right? Because so much of, I do both. I do Western and alternative, complementary, Eastern, whatever you want to call it, right? I call it. I do both because I think there are strengths in each. But
always a balance.
Yeah, I've learned through my journey that we know our baby best. We know our kids best, and everyone knows what they're trained in. And, you know, my dad always says experts know more and more about less and less, right? But what I love about
with him
is that, you know, you had the Western background. You know, your dad was a medical doctor.
Yeah.
You were in the pharmaceuticals.
I was drug dealing.
You know, to this day, you're the only doctor who's read the entire medical file of children, which is, you know, no small read. But
no small read.
No small read. And I just think that is so important, you know, when you're with someone who sees kind of the full picture, and there are strengths to both.
You need to be able to understand both sides to find out the best for the person, whomever that is.
Yeah, and getting to the heart. So rather than Band-Aids, it's actually really getting to the core and undoing some of the work that we've done on our bodies for all these years, or starting early with kids in utero, right?
Exactly.
Through the ped journey to undo some of that, because it just becomes layers and layers and layers that you're putting on.
Compounding your 100%.
And it's the longer that you have to undo the layers, the longer you let it go. So, you know, I've learned that firsthand, and I just to all of you who are tuning in, one of the reasons why Dr. Claire is joining us today is because she's just magic. I wish you were all in Glendale so that you could all.
Thank you very much.
But if you can't, there are other people who have skill sets for your family, and it's definitely something that try it, you know, and I think you'll be surprised, because there's so many things where I took my little one in for, I'm like, tugging on his ear, you know, I think maybe an ear infection. No, it's like one adjustment, fine. And it's amazing, right?
Oh, that was the jaw. Oh, that was easy.
Yeah, I mean, it's just amazing. So you can do so much. You know, like, it's like, okay, I feel like, you know, a cold's coming on. It's like, oh, you do the sick adjustment, you know, and it's like, fine. It's pretty magic. So if it's new to you, then give it a try. If it's not new to you, then you already know what I'm talking about, and try to get in as soon as possible, but it's never too late.
Never too late.
And then it's such a gift that you can give your child, you know, because accidents happen, falls happen, bangs happen.
All the time.
All the time, in my case, right? I mean, that's one of your intakes is like, okay, what are we talking about here? What falls happen, right? Because
what in addition, exactly. Was that the bounce house? Exactly.
Yeah. So the key is lean into this, because it's pretty awesome, and we would be, I shudder to think where we would be without you and your team. So.
Well, I guarantee you, all of us chiropractors we so appreciate and honor the fact that parents will trust us with their children, and pregnant moms will trust us with their bodies. We respect and we honor it, and we definitely appreciate it. I'm going to say maybe a little bit more than medicine. They kind of assume it.
Yeah, well, we appreciate it. So we are going to circle back with you on June 21st, and our focus is going to be on infants to kids. And
yeah. Process up.
Yeah, and all the things that can happen there. And you've seen all my babies.
Oh,
And
your baby.
so tune in. Dr. Claire is going to be joining us again. It's going to be awesome. Lots of insights. And if you have any questions, she is at GFCA_Wellness Center. So you can go ahead and check out her social. If you have any specific questions, I'm sure she'd be happy to point you in the right direction or give you a quick shout out. So thank you very much, Dr. Claire, for your time and for everything that you shared with us today. And we look forward to our focus on peds next month.
Kelly and Prince Lionheart, thank you so much for all the work you're doing to keep babies and little kids happy too.
Sure, we love it. It's what we do. Awesome. All right, take care.
See you.
Thanks,
Bye.